Hi everyone, today I'm going to be explaining why beta blockers are not given in patients suffering from diabetes. So there are two important reasons. The first being masking of symptoms. So when a patient of diabetes goes through an episode of hypoglycemia, there are some symptoms that the body exhibits which we can detect and treat the patient as soon as possible. Those symptoms are palpitation, skeletal muscle tremors, tachycardia, anxiety, sweating. So, a few of these symptoms are exhibited through the adrenergic system and few through the cholinergic system. Beta 1 and beta 2, as we already know, are receptors of the adrenergic system. Beta 1 acts on the heart and the JG cells of the kidney, while beta 2 acts on multiple organs like blood vessels, skeletal muscles, liver, the lungs, and lastly, M3 is a receptor of the cholinergic system, and through its action on the glands, it brings about sweating. So, when a patient is going through hypoglycemia, we'll be able to detect him by looking for these signs like palpitations and skeletal muscle tremors, sweating in the patient. But if the patient is on beta blockers, these symptoms will not be exhibited by the patient and will prolong the duration of hypoglycemia, as it will be difficult for us to detect the signs as quick as possible. So this is the first reason. The second reason is related to the liver. Now we just saw that beta 2 receptors are present on the liver and they have a very important role during hypoglycemia. That is, during hypoglycemia, through the beta 2 receptors, the liver brings about glycogenolysis and gluconeogenesis, which help in the reversal of hypoglycemia. But for example, you're giving non-selective beta blockers to the patient, then these effects will be blocked as the action of the beta 2 receptors is being blocked. So, in conclusion, we should avoid giving beta blockers to a patient suffering from diabetes. But if he has some heart problem due to which we need to administer beta blockers to the patient, it would be better if we administer cardioselective beta blockers like metoprolol to the patient, as it will have lesser side effects because the reversal of hypoglycemia will not be stopped, and we will be at least able to see symptoms like skeletal muscle tremors during hypoglycemia. So cardioselective beta blockers will be safer in a patient suffering from diabetes. So this was all for this video. Thank you for watching.